Hey y'all, go ahead and grab your water bottle, towel, and you'll need a mat today. I want to come on and show you guys possibly two exercises to target back pain. As we age, we start to have back problems, and it really don't matter what age you are, seriously. But we're moving every day, so muscles stay tight, or for some reason, there may have some trauma to it. But anyway, we're going to target the back area. And like I said, I may do two exercises, but anyway, grab your mat. We're going to hit the floor and we'll get started. So what we're going to do, we're going to come to the floor, drawing our abs in. And for us that can get on the floor, I would like for you to get on the floor. Hard to do a glute bridge. Stand where you can't do a glute bridge standing up. So I need you to get on the floor. Now, if you have some type of elevated table, like a massage table or a therapist table, that's different. But anyway, what we're going to do, I want you to get down on the floor, and I want you to draw your navel in real tight. Place your hands by your side, and I want you to rotate your hips. You're rotating at the pelvis. So I want you to rotate your hips at the pelvis. Push in through your heels. It's mind to muscle too. But anyway, so I want you to tilt, and I want you to squeeze your butt cheek and come up. Now, what I want you to do is realize that you want your shoulder in line with your knees. So I'm not going to come all the way up. A lot of people tend to hyperextend on a glute bridge. But what we're going to do, we're going to rotate. We'll pull our navel in. We're going to rotate, and we're going to come up, squeeze our butt cheeks, and squeeze up, okay? So we'll do it again. So we roll, squeeze your butt cheek, and come up, okay? Let's do it again. I want you to roll, squeeze your butt cheek, lift up, keeping your abs in tight, okay? We'll aim to do about 12 of these, and I haven't counted so far. I'm guessing we've probably done about 6. Just follow along. Rotate, squeeze up, okay? Let's do 2 more. Rotate, squeeze your glutes, come up. This exercise is highly, but what's the word I can use? That people take it for granted. It's underrated. And we'll do 1 more. I know I said 2 more. People take this exercise for granted. But your lower back, everything connects. But your lower back is tight. And like I said, and then as we age, so the glute muscles attached to your lower back, everything is connected, like I said, and you want to, strengthen the glute area. And this is the second exercise. It's just called a pelvic tilt. So when I had you to rotate, that's called a pelvic tilt. Okay, so you pulling your navel in to your spine, and you're trying to actually push it where you're pushing it into the floor. So like I said, it's mind to the muscle. So pull your navel in, pull it into the floor, and what you're gonna do, you're just gonna rotate your pelvis. All right. So we come down. All right. We release it. So rotate, abs in tight, and then rotate it back. So it's just really a rotation of your hips, but it's the pelvis. But rotate, keeping the navel in tight, and then release it. Rotate, and then release. And again, we'll rotate. You can place your hand on your pelvis too to feel the hip rotating, all right? So you want to tilt. Hold for a few seconds, and then we come down. And we do it again. Hold for a few seconds, and release it. Let's do 2 more. Rotate it. And we'll do 1 more. Rotate it and relax it. And then when you come up, just depending on how athletic you are, and to keep the strain off your back, just go ahead and roll yourself to the side, because a lot of times we're doing things and we're not mindful. Now I got a little lightheaded. That's another thing too. Depending on how your head is turned down, coming down on the floor, getting up real fast, you'll tend to get lightheaded. It's a possibility you can get lightheaded, but I just did. Anyway, the glute bridge, the rotating of the hip. I will ask you guys to shoot for 12 of those each. So you'll do your glute bridge, do 12 of those, relax it, do it again, relax it, do it 12 times. That's my neighbors. Do it 12 times. Same thing with the pelvic tilt. So you do do 3 sets of 12. These are just some basics. Now, what I'll eventually do is that we'll do all of this stuff together. Right now, I'm just trying to give y'all a guide and a baseline. What I want to do is give y'all a baseline. I want to teach you some of these things so you can know exactly what to do, so you can learn and do it on your own, because you just need to know, and you may not be able to have someone there to always assist you. But anyway, I want you to do 12 of the glute bridges, 12, take a break in between, maybe about a 30-second break. So you do 1 set of 12 of the glute bridges. You relax that for about 30 seconds. Do it again, do it 3 times. Then you will go to your the pelvic tilt. Do that 12 times, relax it, maybe wait about 30 seconds or so, and then do another 2 sets and repeat that. And you can do this 2 to 3 times a week. Actually, you can I'll say do it at least 3 times a week. Do it at least 3 times a week. See where you are from there. It should start to help some of your pain eventually with doing other things too. And the importance of water, not only to keep us hydrated. When I ask you guys to get a water bottle, when you're exercising, a lot of our joints hurt too because we're not drinking enough water. So if you drink enough water, that'll help to lubricate a lot of our joints, okay? It'll get to the muscles where it needs to get, to the bones, to the joints. But not only is the water is good for hydration, but it's good for your joints. So I want you guys to slow it down, and we're gonna ramp it up here. But I want you guys to slow it down and get some of the basics. Get some of the basics right now. And yeah, so thank y'all for taking the time to listen to what I have to say. And until the next video, God bless and be well.